So good morning, everyone. Thank you so much for joining us at 8 o'clock this morning. Really appreciate it. I know everyone has got things to do or busy, but this is very important, so thank you for taking the time. This first screen that you should be seeing that I'm sharing with you right now it's called attendance record. We're trying to make sure that everyone gets credit for attending these. So please, as soon as possible, you can even do it during the meeting if you'd like, email me that you've attended this DPH plan of correction session. So without further ado, we're going to go right into our slides. As you know, we've recently had a DPH survey. We were expecting that because when we merge, usually there is a survey that goes along with that. Our survey was a good survey. The clinicians did a fabulous job with the surveyors in tow. The care of the patients was wonderful. We've got compliments and on that. We did have a few items that the surveyors asked us to fix, improve upon. So we will be touching upon that today. You've already been part of one of the survey corrections, which is our emergency preparedness. The policy that you reviewed via email is part of that. The one item that I would highlight is the E0021, and that's basically a part in our emergency preparedness that has us informing state and local officials if we're not able to contact either our patients or our staff. To that end, making sure that your information in the Chronos or the UKG that highlights, your contact information, your email, your phone numbers, if you have more than one phone, or an emergency contact person. Make sure that that information is accurate because we will need to use that in an emergency situation, let's say when we activate our call tree. The other items on the emergency preparedness, you read on the policies, and that was regarding the use of volunteers in an emergency. And then the other one was how we share our information in case one of our patients needs to be transferred from our care to another setting during an emergency. But we'll focus the bulk of our time together on the items that they call them G items. So they're a little bit more clinically based. The first item is related to timeliness of add-on evaluations and the documentation thereof. So we need to be able to capture any time a patient comes on board with us, and if we need to, let's say, for a reason that, let's say a patient reason that they ask you to maybe come a day later, the following week, we need to capture that in our documentation. So we've, to that end, we've started a audit on our related to these add-on evaluations. DPH found one record out of 10 that they reviewed that we could have done a better job with that. Already in place, we have twice-a-day huddles that include all of the intake folks, scheduling folks, our clinical supervisors, directors. So there's a lot of effort already going into that. We also use reports to make sure that we stay right on top of that timeliness of evaluation on an add-on evaluation. Our second item is the G0582, and that is related to the administration of the flu vaccine, the influenza vaccine. We did make a slight correction or slight change, addition, improvement to our policy. I'm going to see if I can share that with you right now. And here it is. I hope you all can see that. Let me make this a little bit bigger for you. Okay, so now our policy, our admission to home care policy states that agency, that's us, does not offer the pneumonia or shingles vaccine, and it says agency will assist patient in obtaining the pneumonia or shingles vaccine in coordination with the patient's primary care physician and or alternate member of the patient's care team. So even though the patient does not, even though we don't offer those vaccines, we will try to coordinate with the patient's caregivers, the PCP maybe, to obtain that. If the patient declines, that is their choice, that is their right. We do need to still capture that we offered to coordinate, but the patient declined. So we can still capture that as a offered but declined. Okay. The folks that are actually in charge of tracking or auditing this specific item is compliance. So that's Mary Kirby, Pat Lind, myself. So you may hear from us. Some of you may already have heard from us as to how to most accurately capture this specific item. Okay. Our next item is G0706, for all it's worth. It's the interdisciplinary care coordination. This is one of those items that, again, it was one record that was found that they were a bit picky, if you want to say that, on how we were capturing the coordination of care. In other words, if you are having a conversation with your supervisor or with your fellow coworker, or if you're calling the physician's office or a durable medical equipment company, anything that has communication regarding the care of the patient, we need to capture that in a specific section of the narrative note that states care coordination. And not only capturing that interaction, but also capturing, how did that affect the patient's plan of care? Did it go somewhere, as if you would? Okay. The home care directors are Kristen Matson and Lisa Waller are the ones who are auditing this specific item. So you may or may not hear from them or from the supervisors themselves. But this is an item that we feel we do a great job on. It's just a matter of capturing it in writing, as we sometimes like to say, if it's not documented, it's not done. So again, just make sure that it's highlighted who you spoke with, maybe what you spoke about. Did it affect the plan of care? Did it change the way you, did it change your visit frequency or any progress towards goals? In the near future here, we're working on compiling a list of sample statements, if you would, some things that will make it a little bit easier to kind of pick from some items that will help document that accurately. Our last item then is the G1014, and this has to do with the orders, in specific the visit frequency orders, and if they match what's written on the narrative note, if they match what's on the patient's calendar, if they match what's the order that's actually going out to the physician for signature. Again, this was a one record that was found. There are some of us that feel that this might have been a home care, home base little glitch. We have reached out to them. We're still looking at that. But in the meantime, we will be auditing these records. The nursing supervisors will be doing that. So you may hear from them with some education, some hints on to how to most accurately capture that order right up front to make sure that it's what we need to stay compliant. With that said, those are the only findings. These are our plans of correction, if you would. Our audits have been underway now for 2 weeks, and we're finding a lot of really neat things, good results, some learning opportunities, of course. But we welcome your feedback. Certainly, if you have any questions, I would encourage you to email them to me or email them to your supervisor. But most importantly, and I'll bring this screen back up if I may at the very end, please, please, please take credit for attending this, taking time out of your day to attend this with us. So at this point, I'm going to stop the recording